Good afternoon, everyone, and welcome to Continuous Learning with Bioguard. My name is Sushant, and today I would like to invite our speaker, Dr. Robert Lowe. So, welcome, Dr. Robert. Dr. Robert obtained his DVM degree from National Chiayi University in Taiwan, and also he is honored with a PhD from the College of Veterinary Medicine from Mississippi State University. He is an expertise in virology, clinical microbiology, and immunology. So previously, he has worked as a director of the reference lab at Bioguard, and currently he is our technical advisor as well as technical officer in our company. So let's welcome Dr. Robert.
Thank you. The introduction from Dr. Susan, and good afternoon, everyone. It's my pleasure to have the opportunity to do an overview of feline Parvovirus with you. So I'll share my screen with you. Before I start today's talk, I will invite all of you following Bioguard's Facebook and LinkedIn. That's our social media of Bioguard. We post lots of knowledge-based information on our social media, and also we also post some product information, including new product information in our social media. So I would encourage all of you follow our social media so you can get the most up-to-date knowledge information and also our product information from Bioguard. Thank you. So let's start today's talk. So for feline Parvovirus, or FPV for short, sometimes it's also called Feline Parvovirus or feline infectious enteritis, or even an old term, feline distemper. All of them are talking about the same disease or the same virus. This FPV is first described in 1928, and it's almost 100 years now. And the first FPV virus is isolated in 1965. This is a very small single-stranded DNA virus in our environment. And since we know this is a parvovirus, this FPV can infect domestic cats and also other Felidae, as well as like a raccoon, mink, and fox. And once the cats got infection, for those susceptible cats, means they would, without proper immunity, the whole population may be wiped out once they got the infection. And when we are talking about the feline parvovirus, we cannot forget the canine parvovirus type 2, or the CPV2. This CPV2 is closely related to FPV. It's actually later identified later than the FPV. In the late 1970s, the CPV2 evolved from the FPV after crossing over other species barrier. Then within a year, it just evolved into the CPV2A variant, and later have the CPV2B and CPV2C. Nowadays, it's hardly here the CPV2. It's always the CPV2A, 2B, or 2C around the world. And the the evolution of FPV and CPV2 is actually starting from the FPV. When the FPV first infect the cat, then it may infect other species like a raccoon or foxes, and then it can become infected to dog. And during 1970, the FPV virus, the VP2 protein of FPV virus undergoes some amino acid mutation. And with those amino acid mutation, it becomes the CPV2. And at that time, the CPV2 can only infect dogs, but cannot infect cats. But soon, it happened very soon. The CPV2 evolve again, become the CPV2A. And the CPV2A can infect both dogs and cats. Then after a few years, the CPV2A evolved into the CPV2B and then CPV2C. And like in Taiwan, actually right now, there are all three variants, like the CPV2A, 2B, and 2C in Taiwan. And for this CPV2A, 2B, and 2C can also infect cats. So how do the cat become infected with the FPV or CPV2A, 2B, 2C? It's because once the cat infected with the virus, cat can shed the virus in their urine, feces, and even from the nasal secretions. And the infection can occur when the susceptible cat come in contact with this secretion or feces, or even the fleas from the infected cat can cause the infection. So it can be direct or indirect. Even the bedding, cages, food dishes, and the hands or clothing of people who handle the infected cats may also carry the virus and transmit it to other cats. So it's very easy for the transmission. And also, once the virus is shedded in the environment, it's difficult to be destroyed, and it's resistant to many disinfectants, and it can survive for up to a year in the environment. So some previous study report that typical FPV shedding duration in cat is 1 to 5 or 2 to 7 days, but shedding can persist for up to 6 weeks in one cat in an early study. So the shedding of the FPV is actually depends on the cats. Each individual may have a different shedding period. So talk about the pathogenesis of the FPV. We know the main transmission route is through the fecal-oral route. And when the FPV will initially replicate in the tissue of the oral pharynx, and then over there, it will distribute via the cell-free viremia and then to virtually all tissues. And this replication of FPV, because the FPV replication requires rapidly multiplying cells in the S phase of the cell division, it's same thing as the CPV2. And so it's therefore restricted to mitotically active tissue like lymphoid tissue, bone marrow, and intestinal mucosa. Those are the most frequently affected tissue in cats older than 6 weeks of age. So for cat older than 6 weeks of age, you can see many infect the lymphoid tissue and cause the cellular depression, lymphopenia, and functional immunosuppression. And also, once it invade the bone marrow, it can replicate in those progenitor cells. And after virtually all, it can affect virtually all myeloid cell populations. And that's why once those myeloid cell population are affected, it will we will see the panleukopenia in the infected cats because all the white blood cells population are decreased. And if the FPV virus invade the small intestine, usually it will infect the germinal epithelium of the intestinal crypts. And from there, it will disrupt and make the epithelium collapse. Once this happens, the absorption function of the small intestine will be abnormal, won't have a normal absorption function. As a result, the fluid will lose from the diarrhea and widespread infection inside the body. And also, sometimes if the FPV it can be infected from the queen. If the queen had during the pregnancy, the mother cat have the FPV infection. The virus can be transmitted to the fetus through the intrauterine route or through the perinatal infection. And when this happens, the most cells in the fetus, it will infect most cells in the fetus and cause the fetal death or the absorption of the fetus. And it will also affect the development of the cerebellum. It will affect the central nervous system and cause the cerebellar hyperplasia. That means the smaller size or not fully development of the cerebellum in the infected fetus or the kittens. And if the kittens survive, they are not undergo the absorption or cause death right after the give the birth. It may have the cerebral ataxia in those kittens. And the figure here, the upper bar, is the normal development of the cerebellum, and the lower part is the you can see the cerebellar hyperplasia here. So let's make a quick root of how the CPV or FPV causes the disease in cats. So the transmission may through the inhalation or ingestion. Anyway, it's usually the fecal oral route. Once the virus get into the cat's body, the incubation period may take 2 to 10 days. It's because it depends on the cat's immunity and also the virus, the amount of the virus being updated into the body, or sometimes even the virus strain may also cause the difference. And once it gets into the cat's body, it will replicate in the small intestine, in lymph node, or in the bone marrow. And once the infection occurs, the virus can be shedded through the feces, the vomiting, the saliva, or even the urine. All those secretions, the virus can be secreted from those secretions. And similarly, if the dog infected with the CPV, this also may happen, and also have will have the viremia in the sick cats. This is an experimental infection of the FPV and CPV in cats. This study is done in 2017. They try to analyze the feline and canine parvovirus infection in vivo, because this infected the experimentally infection study in cats with the both FPV and CPV2B. And the figure A, we can see the figure A, that's the virus shedding in the inoculated cats. Because it's in cats, so we can see it actually. Let me see if I can use any marker here. Sorry. So the figure here, this one is the FPV shading in the sorry. Yeah, that's the FPV shading in the infected cats. You can see, and also the shading of CPV in infected cats. Usually, in their experiment, the shading can be detected starting from the second day post inoculation, and sometimes, of course, because that's the experimentally infected situation. So not every case will be like this, but usually 2 to 3 to 5, even to 7 days of the incubation period may be possible. And then in this case, because they're collecting the shading of the through the anal swab until the death of the cats. So for the FPV case, they're collecting the feces and the anal swab until 9 days post inoculation. So from the 2 days post inoculation to 9 days post inoculation, the FPV can be detected from the feces. And also if the cat is infected with CPV2B sensing, because this inoculated cat survived a little bit longer than the other cat infected with FPV. So from sensing from day 2 to day 12 post inoculation, and by the way, they infect the cat with the same virus amount, the same title of the virus of FPV and CPV2 cats. So still, we can consider the FPV is still more virulent to the cat compared to the CPV. And the figure B here, is the viral replication in tissue of inoculated cats that were euthanized on 5 days post-inoculation. So you can see the virus is identified, the virus title is here. They can detect the virus from the brain, heart, liver, spleen, lung, kidney, stomach, and also the intestine, and even the second column. And all those tissue, the virus can be isolated and do the titration. And same thing we can see for the FPV, they have the title of the virus. FPV have a higher titers compared to the CPV in those infected tissues. And by the way, because the age of the cat being infected is the 10-week-old. So since the cat is in this age, older than 6 weeks old, so they didn't check for the cerebrum. They only check they check the brain, the virus title in brain maybe a little bit lower if compared to those if the cat infected at the younger of age. So let's check the clinical sign. Let's check the clinical sign of FPV or CPV infection. Well, because the FPV can affect cats of all ages, and kittens are most susceptible, and the mortality rate are high, especially for kitten. If without proper and prompt treatment, more than 90% of the kitten may die. And even with the treatment, the mortality rate may still be maybe still between 30 to 50%. And depending on the infected cell types, the disease sign may include diarrhea, lymphopenia, neutropenia, and followed by thrombocytopenia and anemia. And also, it may have a transient immunosuppression because of the neutropenia and lymphopenia. Those are important in the for the immunity of the cat. And for the queen, if they are infected during the pregnancy, it may have absorption. And for the young kitten, or even during the fetus stage of the infection, those kittens may have cerebral ataxia sign appear. And sometimes the death can occur very rapidly, that even no clinical signs are observed in those sick, severe sick cats. And for the diagnosis of the FPV and CPV in cats, basically, I think for the mostly when the cat come to the clinic, most vets may have the initial suspect if the cat have the FPV or CPV infection. Sometimes similar to the dog. If the dog have a CPV infection, usually when it come to the clinic, most vets can very soon recognize there's a possibility of the infection of the CPV or FPV. So just based on the signalment history and the clinical sign. And also for the cat, once it have the CPV, FPV infection, it will, for the CPC may show the low white blood cell count. And for most clinic, they may also use the rapid test using the stool sample to detect the FPV infection. And however, sometimes the false pass, once it need to be noticed, the false positive result may occur if the cat was vaccinated for the FPV modified live vaccine within 5 to 12 days prior to the test. Because those live vaccine FPV, although it's attenuated FPV virus, it can still cause the infection and a little bit infection and replicate in the intestinal and then shed from the feces. And for the other test, right now are getting more popular. It's the PCR or the real-time PCR. For the PCR or real-time PCR, can use the specimen of feces or blood, and for the PCR, because the rapid test price-wise is more economy, it's more cost-friendly. So for the PCR, if the pet owner consider the PCR test is more expensive, you can consume them because still PCR is the most sensitive, have the highest sensitivity and most accurate way to detect the CPV or FPV infection. So you can suggest if they think it's too expensive, can check, can use in when the rapid test show negative, the cat with panleukopenia or with the obvious clinical sign of the FPV, at that time you can consider use the real-time PCR to test to do the test, help you to make the definitive diagnosis. And for the treatment, we won't focus too much in the treatment because I believe all of you are the expert. I'm more familiar of how to treat the FPV or CPV infection than I am. So we just kind of go through it because usually it's like based on the clinical sign. We just try to read and make the clinical sign not that severe and try to correcting the dehydration issue caused by the diarrhea or vomiting, and also providing the nutrients to let the cats have better stay in better condition of their body and the immunity, and then also try to prevent the secondary infection. So sometimes if suspect of the secondary infection, or just try to avoid the secondary infection, may also give the cat the antibiotics. And for intensive care and treatment are critical to support the cat's health with medication and fluid until its own body and immune system can fight off the virus. And without such supportive care, up to 90% of cats with FPV may die. And speaking of the prevention, the best prevention way of the how to protect the cat from the FPV or the CPV infection is the vaccination. Right now, the vaccination is usually the suggestion for the WASABA, like they suggest for do not give the pets younger than 6 weeks of age, and then every 3 to 4 weeks later can give another shot until the cat reach the age of 16 to 20 weeks. And it's for those high-risk situation, this vaccination can continue until 20 weeks of age and consider vaccinate every 2 to 3 weeks. And after this, the first booster vaccination should be given 1 year later. Then the frequency of the booster vaccination may be only every 1 to 3 years, depending on the vaccine, disease, and the risk of for each individual cat to get the infection. And the figure here, this figure on the right-hand side, let's just show you how maternally derived antibody, the MDA, interfere with our ability to immune puppies or kittens through early vaccination. You can see the red line, that's the NDA, the maternally derived antibody. When the kitten or puppy just got the milk during the first 24 hours after birth, they will get the maternal antibody through those milk. And those maternal antibody will protect the kittens and also the puppies from the infection of the pathogen. Like here, we use the FPV as the example. And so if we give the kitten when they are younger than 6 weeks of the age, at that time, the maternal antibody is still high. By the way, the blue line here, the blue line here, that's the protection level of the antibody. That means if the antibody is above the blue line here, it can well protect the kittens from the FPV infection. So when even the maternal antibody drop below the blue line here, although it cannot fully protect the kitten from the FPV infection, it still have the ability to interfere with the the vaccination, because those antibody will react with those vaccine virus and kill them. As a result, the vaccination won't be effective. So the suggestion is no earlier than 6 weeks of age to give the first shot, usually between 6 to 8 weeks of the age. And because at that time, the monoclonal antibody usually already below the protection level. Also, at that time can start to give the vaccination. And then once it starts, every 3 to 4 weeks, give another shot until the kitten reaches the age of the 16 weeks old. And in this way, it can provide the most comprehensive coverage of the protection to the kittens or puppies. And so here we just check the vaccination guideline from WASABA 2024 for the cats. We just introduce you the core vaccine, including the FPV, FCV, the feline Parvovirus and feline herpes virus. So we say if the kitten get the first vaccination younger than 16 weeks, as we just mentioned previous, start no earlier than 6 weeks of age and revaccinated every 3 to 4 weeks until 16 weeks of age. And in especially high-risk situation, the vaccination should continue until 20 weeks of age of the kitten. And also consider give the vaccination every 2 to 3 weeks. And for those cats older than 16 weeks of age, if they get the first vaccination at that time, just give them 2 doses of the vaccination, 2 to 4 weeks apart. Those are generally enough for those cats older than 16 weeks of age. And for revaccination suggestion, you can just see from this table. And also for the prevention, one thing is important. Once the household, if you are a multi-cat environment or even in the clinic, because once there's a FPV, like we just mentioned, the FPV is highly resistant, and including the CPV. They are highly resistant in the environment, can survive up to 1 year or even more than 1 year in the environment without proper disinfection. So usually that's what we suggest. The easiest way is use the household bleach, do the 1 to 30 dilution. It can disinfect the food and water bowls, because those may also carry the circulated FPV or CPV virus, and also other contaminated items. And other disinfectant like potassium peroxymonosulfate or other accelerated hydrogen peroxide can also be used. But of course, the most easy one is just use the household bleach. And it's very effective too. And since we have a talk about those FPV or CPV infection in cat, that's something we usually may we may encounter in the clinic is sometimes the cat or dog we see the severe case of the severe case of the CPV or FPV infection. However, when we use the rapid test, try to detect the CPV or FPV antigen, and the result show the negative. That's what we call, maybe we can call the false negative result in the rapid test. And the reason is because we in Bioguard, we happen to have a very complete CPV case similar to this in this situation. And for FPV, it's also similar. We'll have a similar situation. So here we will share this CPV case with you. There are three-month-old puppies. They live outdoors, and they are from the same litter. And all three puppies already got their first dose of CPV vaccine 1 month before the hospital visit. And the first hospital visit is in the summer, July of the year 2021. And over there, when those puppies arrive at the hospital, the clinical signs for those puppies, including for puppies A and B, have more severe clinical signs. And the best observed the vomiting, severe bloody diarrhea. You can see from the puppies A and B here, and also see other blood work show hypoglycemia and low white blood cell count. And those two puppies died within 2 hours at the hospital. And the third puppies, here we call puppy C, have some fatigue and in the patterns. And however, at that time, the white blood cell count is normal. And because of the clinical sign, the best highly suspect the infection of the CPV. So they use the rapid test, using Bioguard 3DS to detect the CPV, CCV, and Giardia for those 3 cats. And for those 2 severe puppies, all the test results show negative. And for the third puppy, the one with mild symptom, the CPV show positive in this case. So at that time, the vets call us, ask us, why the CPV rapid test in severe case of the puppy show negative reaction, and in mild case show positive reaction. So to figure out the issue and answer the questions from the vet and the clinic, so we bring those feces sample from the hospital back to our reference lab in Bioguard. And then we do the repeat test again with those feces sample from those 3 puppies. And same thing, the green. The green indicator here kind of interfere with the puppy C's result. Puppy C's result here is actually positive in this case. And puppy A and B both show negative. Let me adjust the photo a little bit to let you see it more clear. Okay, so let's see the photo again. In the figure here, that's the repeat test we done in our reference lab. You can see for puppies A and B, the repeat tests of CPV still show negative. However, the puppy C show the obvious positive reaction. Sorry. Yeah, sorry, forgot to make the PowerPoint format. Yeah, you can see for puppies A and B, the repeat test show negative, and puppy C show up. We can observe the obvious test line show positive here. And we also use the other brand of the repeat test using the same feces sample from these 3 puppies, and we get a similar result for puppies. Both puppies A and B show negative result in the CPV repeat test, and puppy C also show positive result in another brand of the repeat test. So to further evaluate what's the cause of the situation, so in our reference lab, we decide to run the PCR. So we use 2 different set of primer, identify 2 different nuclear sequence of the CPV in the feces, using the feces sample from those 3 puppies. And here, that's the puppy C. You can see puppy C, B, A for the first primer set, and puppies C, B, A using the second CPV primer set to do the CPV DNA detection. And actually, all 3 puppies, we detect the CPV virus gene from their feces. And we also send the DNA, the amplified DNA from the first primer to the sequencing lab to do the virus sequencing, try to identify what's the virus. And the sequence results show all three from the CPV2C of the virus, and it's reasonable because all three are from the same litter. So the virus they infect should be from the same strain. And then we also do a semi-quantitative test of PCR, try to identify the DNA amount of those of the CPV in those three puppies. So the semi-quantitative result here, we can see at that time, puppy C is with mild CPV infection, have the most DNA of CPV virus in the feces. And for puppies A and B, the DNA of the CPV are far less than the DNA of CPV in puppies C's feces. So at this time, we figure out actually based on our PCR result, we know all three puppies were infected with CPV2C at that time. However, in their feces sample, for those two severe cases, puppies A and B have a much fewer CPV virus in the feces. And for the mild one, on the contrary, on the mild one, the puppy C the feces had higher copy of the CPV virus in the feces. And that's why when we are doing the repeat test, because the sensitivity of the repeat test, or we call it detection limit, is not as high as the PCR. So that's why at that time, the repeat test result for puppies A and B show negative. And only puppy C show positive reaction. And for the PCR reaction, all three puppies, we can detect the parvovirus at that time. So here is the pathogenesis of the CPV2, because once the dog is exposed to the CPV2, the CPV2 will replicate like just same thing as the FPV in cats. It will replicate in oropharynx and then spread by a cell-free bulimia. And the virus may start shedding in the feces, like here in day 3 post-exposure. Different individual may have a different shedding. The shedding may start at a different time, but here we just use the day 3 as an example. And at that time, the infected dog will have the marked bulimia usually, and also can see some manifested by intestinal diseases. And from day 4 post infection to 10 days post infection exposure, some dog can continue to shed the virus. The clinical sign will begin 4 to 10 days after exposure, and some dog can continue to shed the virus 3 weeks after onset of the clinical sign. But usually, the virus shedding begins to decline 6 to 10 days post-infection. So at that time, if we do the repeat test, it may show the false negative because the shedding of the virus is decreased, and also the large volume of the diarrhea may also dilute the amount of the virus in the feces sample. And sometimes even those severe infection, because both CPV and FPV infect the crypts of the small intestine. When those crypt cells are destroyed, there won't be any APC dividing, highly active dividing epithelial cells for the virus to replicate. As a result, the shedding would decrease. So that's why it may cause the false negative reaction. And then after day 12, the CPV2 may rarely recover in the feces. And however, if we use the PCR or real-time PCR, because of the high sensitivity, or it can detect the, it have a better detection limitation. So at that time, using the PCR or real-time PCR, we can still detect the CPV infection. And for the FPV, the incubation period, same thing, we need to focus again. The incubation period may vary from each individual because of their immunity and the amount of virus they get embedded into the cat's body, but usually 5 to 7 days. And the shedding time, based on some, because different study may have a different suggestion, but the shedding time is often before the clinical signs are apparent, and some cats may shed the virus up to 6 weeks even after the clinical recovery. Like we just mentioned in the very beginning, in one study, they found the cat 6 weeks after the FPV infection, they can still detect the FPV from the feces. But in average, it's shorter than 3 weeks for the shedding. So for the conclusion in this, why do FPV CPV rapid tests show negative result in the severe FPV or CPV case? So it's because animal can test false negative on this test if they are shedding small quantity of antigen in the early or later stage of illness. And also the antibody titers may also contribute to the result of false negative, because the antibody will bind to the virus antigen. And as a result, those antigen cannot be recognized or captured by the FPV or CPV monoclonal antibody labeled on the rapid test strip. And so the similar result were also observed in the FPV shedding study. In a study, the rapid test was positive in 12 of 16 kittens. On the day the cat was diagnosed as the FPV, and only 3 of 16 on day 3 after the diagnosis show the FPV rapid test positive results. So for our suggestion is, for the diagnosis of the FPV or CPVs, if the animal tests negative by fecal rapid test, and there's a concern for invasion of other animals in breeding cattery or shelter, the additional testing by PCR or real-time PCR should be considered. And the real-time PCR, like a Bioguard, we offer the in-house real-time PCR. This can detect lots of different pathogens in cat, in dogs. Like in here, of course, in this case, we can detect the Feline Parvovirus from the feces sample in this case, and other possible pathogen causing diarrhea, like coronavirus, like Giardia, can also be detected using our Q-mini real-time PCR detection kit. That's my the sharing of the overview of feline panleukopenia infection with you today. If you have
Thank you,
any
Dr.
question,
Yeah, thank you, Dr. Robert. Yeah, if you have any questions, please write it down in the Q&A box. Yeah, sure. Paulina, you're asking questions. You can type. Yes. So, Dr. Robert, the first question is, does it matter whether the virus is determined quantitatively or qualitatively?
it depends on your purpose, but because for the clinical, if you can see the no matter is the quantitative or semi-quantitative, you can from the same, I would emphasize from the same patient, like from the same cat, it's good indicate because if you after like once the cat get infection and you detect it, and after treatment you want to see if the cat is have recovered or getting better from the infection. In addition to the clinical sign and other like a CBC or the blood chemistry, you can also do the real-time PCR and check if the virus titer significantly decrease. I would say the CT value, or sometimes if you compare the CT value, you will know if the cat have a higher amount of the virus in their feces or lower amount of the virus in their feces.
Okay, thank you. So the second question is related to vaccination. So it is necessary to determine antibodies before and after vaccination.
Ideally, it's good, but in real situation, it's not easy to do because even for the kittens or puppies from the same litter, each kitten or the puppies may have a different titer or level of maternal antibody because it depends on how much milk they got during first 24 hours after birth, because that's the only time they can get the maternal antibody from the milk. So if you really want to do it, you need to do every individual. In that case, you can estimate when is the best time for the vaccination to start and when the kitten or puppies have higher enough antibody to protect them from the infection. So that's why the WASABA, they just give a guideline suggest no early than 6 weeks of age, and then starting from 6 to 8 weeks of age, start the first vaccination, and every 3 to 4 weeks get another shot until the puppies or kittens reach the age of 16 weeks old of age. But if you really, if the pet owner only have one pet, they are willing to do that, and of course you can do that to evaluate the antibody titer for each individual, each kittens or puppy before and during the vaccination process.
Continuing this question, it's just my thoughts that does vaccination can cause development of antibodies in the body if the maternal antibodies are not there, but does vaccination can cause antibodies to develop in the kitten?
If the puppy or kitten still have the maternal antibody inside their body, those maternal antibody will react with the vaccine virus, and then at that time, those virus from vaccine cannot stimulate the immune response fully to develop the antibody.
Okay. Okay, Paulina, is there any other question? Do you have? Okay, the next question is, are there species of different tests? For example, there are regular antibody tests and there are post-vaccination tests. Is there really a difference between these tests?
I think you can check the lab you are cooperating. Usually it should be the same because they usually use the same I would say same methodology or like a similar. In reference lab, they may use the ELISA because they want to detect the antibody titers. So they may actually use just the same ELISA test and do the test to evaluate the antibody titer for the cat or the dog. And I believe they are usually checking the IgG. So for me, it should be the same. But you just need to use the same test to evaluate the same kitten. So that's my suggestion. Don't send to lab A for this time, the first test, and send to lab B for second test. So you cannot compare those results together to see how the antibody go up or go low, because they may use different kit, or maybe even, and they may not even use the same ELISA test. So you cannot compare two different test results to evaluate the antibody titer if it's go up or go down.
Okay. Paulina, are there any other questions? Okay, so I think if you have any other questions related to the talk, you can always share later, and we will get back to you with the answers. Other than that, we will be also having a recording of the presentation, so you can share with the listeners later on. Lastly, we will issue the e-certificate for all the listeners who have been attending this webinar today. So I thank you everyone for joining, and we will please follow our social media for upcoming webinars, and let's continue sharing the knowledge, and we'll see you soon next time. See you. Bye-bye.
Thank you. Bye.